Good morning to all of you, to Raul, who joins us today, to our sign language interpreter, and to all of those following us in different parts of Cuba and the world. Excuse me while I remove my face mask. Today, 838 people are hospitalized in Cuba. 14 are under observation. There are 412 suspected cases and 412 confirmed active cases, quite a high number. In our primary healthcare system, 11,064 people continue to be monitored by our professionals and specialists. Yesterday, over 4,000 samples were processed, 4,262 to be exact, were processed in our various molecular biology laboratories. 1,711 were processed at the Pedro Curi Tropical Medicine Institute, 798 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 470 in Havana's, 443 in the Genetic Engineering and Biotechnology Center Lab, 427 in the Hermanos Almajeires Hospital Laboratory, 278 in Santiago de Cuba's Hygiene, Epidemiology and Microbiology Center Lab, and 136 in the Civil Defense Laboratories. Of the 4,262 samples processed, 65 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 297,331, of which 2,953, or 0.99%, have tested positive for the virus. Yesterday, samples were tested from all of the country's provinces. 2,552 from Havana, 1,095 from Artemisa, 125 from Santiago de Cuba, 84 from Mayabeque, 76 from Villa Clara, and so on and so forth from all of the country's provinces, with more samples processed from provinces facing a complex epidemiological situation. Of the 65 positive cases diagnosed yesterday, 64 are Cubans and 1 is a foreigner. Of the 64 Cubans, 37 are confirmed case contacts. This brings the total number of confirmed case contacts to 2,461, or 84.6% of all diagnosed cases. 20 people who tested positive for the virus yesterday contracted the virus abroad, for a total of 300 imported cases, representing 10.4% of all confirmed cases on the island. In 7 of the 65 cases diagnosed yesterday, it has not been possible to determine the source of infection. This brings the total number of cases where the source of infection is still unknown in Cuba to 146 of all confirmed cases. The foreigner who tested positive for the virus yesterday is a confirmed case contact. 38 people diagnosed yesterday are male, for 50.5% of all cases in Cuba. Meanwhile, 23 are female, representing 49.5% of all diagnosed cases. As you can see, a similar rate for both sexes. 51 of the 65 were asymptomatic at the time of testing. These cases, therefore, account for 1,689 people, or 57.2% of all positive cases on the island since testing began. When we look at this figure over the last 15 days, it stands at 57.6%. By age group, of the 65 positive cases diagnosed yesterday, the majority are between 41 and 59 years of age, with 28 cases. 27 are between 20 and 39 years of age, 8 are over 60, and 2 are under the age of 20. As you can see, young people make up the majority of cases diagnosed yesterday and over recent days. The 2 cases under the age of 20 diagnosed yesterday bring the total number of patients in this age group to have tested positive for the virus in Cuba to 325, of which 294, or 90.5%, have responded positively to treatment and been discharged from hospital. Of the 65 positive cases, 45 are the result of local transmission, while 20 are imported. Of the 45 autochthonous cases, 17 belong to Artemisa and the municipalities of Mariel, San Cristobal, Candelaria, Caimito, Bauta, San Antonio, and Bahia Honda. The 24 cases from Havana diagnosed yesterday belong to the municipalities of Plaza, Habana del Este, La Lisa, Marianao, 10 de Octubre, Arroyo Naranjo, Boyeros, Centro Habana, Guanabacoa, Habana Vieja, and Playa. As you can see, cases in the capital are spread across many municipalities. The same can be said for Artemisa. 5 cases were diagnosed in Villa Clara from the municipality of Camajuaní, all linked to an episode of local transmission in the area. And in Las Tunas, a child tested positive for the virus after coming into contact with a previously confirmed case. The 20 imported cases belong to almost every province: La Habana, Artemisa, Villa Clara, Las Tunas, Santiago de Cuba, Pinar del Río, Mayabeque, Matanzas, Sancti Spiritus, Camagüey, Holguín, and Guantánamo. And let me clarify something. None of these cases were the result of local transmission or were physically in their respective provinces, as they were taken to isolation centers on arrival at the airport. At these isolation centers, they were then tested and diagnosed with the virus. Yesterday's results therefore mean that Artemisa continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 25.25. This is higher than yesterday's figure. Havana follows with a rate of 9.41 per 100,000 inhabitants. Villa Clara's rate also increases from yesterday's to reach 1.80. With one confirmed case, the rate in Las Tunas rises to 0.19, while Pinar del Rio, which also registered a case recently, has a rate of 0.17. This means that Cuba's rate also increases to 3.1 per 100,000 inhabitants, higher than yesterday's figure. Of the 2,953 people who have been diagnosed with the virus thus far in Cuba, 412, or 13.9%, are active hospitalized cases. 405, or 98.3%, are clinically stable. No COVID-19 related deaths have been reported in Cuba for the last 5 days. Since the pandemic began, the island has registered 88 fatalities, for a mortality rate of 2.98%, which, compared with the regional rate of 3.68% and the global rate of 3.72%, places Cuba in 21st position in the Americas and 113th in the world. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 9 people were discharged from hospital, 5 from Artemisa and 4 from Havana. This means that, to date, 2,451 people, or 83.1% of all confirmed cases in Cuba, have recovered from the virus. There continue to be 7 patients reported as serious but stable. These patients are all from Havana and are being treated at the Salvador Allende Hospital in the Cuban capital. This is the situation in Cuba. As you can see, we have a high number of cases. Not as many as in April and May, when 74 cases were reported in a single day, but still the highest we've seen over recent weeks. Now we're going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. The total number of COVID-19 cases worldwide currently stands at 19,357,085, after 280,340 people were diagnosed with the virus yesterday. Yesterday, 6,556 people died of the virus, for a total of 721,174 COVID-19 fatalities, and a mortality rate of 3.72%. For every 100 people that catch the virus, 4 die of it, which shows that this is not just a common cold, but an illness with potentially serious complications. The region of the Americas, which accounts for 54.07% of all COVID-19 cases worldwide, now has a total of 10,468,123 confirmed cases, after 154,533 were reported yesterday. Of the 6,556 COVID-19 fatalities reported yesterday across the world, 4,122 occurred in the region. This brings the COVID-19 death toll in the Americas to 386,124 and a mortality rate of 3.68%. Just like yesterday, the United States continues to top the list of countries with the highest number of cases, with almost 5 million. The US currently has 4,941,796 cases and 1,252 COVID-19 fatalities were reported yesterday, for a death toll of 161,356. Brazil follows with almost 3 million cases, 2,962,442 to be exact, and over 1,000 deaths reported yesterday, 1,079. This is the information that we have on the behavior of the pandemic in Cuba and the world.